today to talk to us about, what's going to happen with Democrats in the House. Is this going to deter any type of progress? Peter Pitts, he is the founder of the Center for Medicine in the Public Interest. He is also former FDA Associate Commissioner. Peter, welcome to the show.
My pleasure. Thank you very much.
Our pleasure. Okay, so you wrote an article for Real Clear Health about how Elizabeth Warren is basically going to threaten any type of medical progress. Can you talk a little bit about that?
Sure. One of the things that Senator Warren feels is raising prices and restricting healthcare in this country is intellectual property protection and patents. And I happen to think it's exactly the opposite, because when you think that the government can not only provide healthcare, but also invent it and remove any type of incentives from the free market system that has developed these wonderful new drugs, devices, and hospitals that we have today, things are going to go in the absolutely wrong direction. It's terrible rhetoric to blame the private sector for all the beautiful things that have happened in healthcare. Government has an important role to play, but to expect government not only to provide healthcare, to make Uncle Sam MD, but then to say that we also want Uncle Sam to develop all the new drugs and all the new devices, it's living in fantasy land. And she's saying these things, is getting traction in the mainstream media, and it worries me.
What do you think her motivation is?
Well, I think her motivation quite simply is to get elected. I think she says these things, people applaud, the press reports on it positively, and so she continues to do so. And the same is true for Senator Sanders when he talked about things like Medicare for all, without saying that it would cost, about $32 trillion over 10 years, and there's no way to pay for it. And when it comes to things like Medicare for all, universal health care, the state of Vermont, a small state population-wise, passed a piece of legislation to go forward with that type of thing. And the governor, a Democratic governor in Bernie Sanders' state, had to go back on his word because they realized they couldn't raise taxes high enough to make it happen. So when reality intrudes, they try to find other people to blame rather than trying to get their feet more firmly planted in the real world.
So, Peter, this president has been trying to take steps to fix our healthcare system. Of course, Obamacare was a disaster. I'm here in California, and we were hit maybe even the hardest in the entire country as far as providers and price for quality and things of that nature. The issue of pre-existing conditions continues to be a sticking point in this healthcare debate. Now, I understand, the non-heartless side of me says, of course, people should have their pre-existing conditions covered. However, from an ideological point of view, this is like me waiting until there's a fire in my apartment to purchase homeowners insurance or renters insurance. But one of the things that President talked about in a new, revitalized, and better healthcare system was creating competition across state lines. Are there any other little nuggets of improvement that you think would help if we can't throw Obamacare out completely? What are some things that we can implement within the healthcare system to make it better?
One of the things we learned from the Affordable Care Act, Obamacare, is that having health insurance is not the same thing as having access to the health care that you need when you need it. And one of the key problems, I think, within our system is you can't buy, as you mentioned, insurance policies across state lines. I live in New York. I've got a family of 4. Why should I have to pay 30% more than the exact same policy in Wisconsin? This replicates itself across states, across disease states. What we've got to do is inject greater competition into the marketplace. And one of the things that the president's going forward with throughout the various ideas, throughout the various blueprints, is to make sure we've got a firm free market foundation going forward on healthcare reform. And clearly, selling insurance policies across state lines is one of them. Also, it's making sure that we have people that have the type of policies that they need. Not everybody should have to buy a policy that covers pregnancy. My wife and I are 60. Why do we need a healthcare policy that provides pregnancy coverage? The Democrats will call these thin policies. But the fact of the matter is, I think people are smart enough to know what type of insurance they need. Some people will make better choices than others, but like with Medicare Part D drug benefits, people said, seniors can never make the right choice. And they've made very smart choices. And this 90% approval rating. I think when we give people the opportunity to make the right choices they can with as little government encumbrance as possible, good reforms happen.
Why are Democrats so opposed to that? Is it just about they want control, or they don't think that the consumer can make the right decisions about their own health? What is their motivation?
Well, all of the above. Firstly, if you believe that big government is the solution, and you believe that policies that decrease the role of government are bad. And I think also there's a real prejudice against people being able to make their own decisions. I believe most people, when it comes to healthcare, will make the right decision. Some people will make mistakes. When Medicare Part D was passed, the Democrats said, we're going to run against this nationally because there's no way seniors can make the right choice. And then when they realized people who are Medicare eligible were making great choices and that they were very happy about it, they changed their tune almost immediately. But I guess the two-part simple answer to your question is, one, they believe government is the answer to every question. And secondly, they don't believe that people, at the individual, can make proper choices for themselves minus the big hand of government.
You know, people complain so much about the government. It's amazing to me how many people out there think that it's a good idea to give the government more control over aspects of our life. It's amazing to me. But Peter, you are the founder of the Center for Medicine in the Public Interest. Tell us a little bit about that organization, some of the projects you're working on.
Oh, thanks for asking. We're at cmpi.org. And what we do is focus in on free market ways that healthcare can be improved, that we can get new medical products, so people can lead healthier, longer lives at affordable prices, and that there are ways to get this done by embracing free market principles and making sure government, while an important partner, is not the main partner. We're doing a lot of work on ways to enhance insurance coverage, on ways to increase personalized medicine so people get the right product they need at the right time, so they get well quicker, stay out of the hospital, and just focus on value as opposed to, strictly speaking, price. That value is the denominator, and that everything else above the line, including price, is important, but this healthcare in this country needs to be reformed by focusing in on making people's lives better. It's the primary, most important thing that we do.
So what role do you think, does your organization think the government should play?
Well, the federal government and state governments, to that matter as well, have a very important role in helping to develop new, innovative policy solutions, working with the private sector. You know, it isn't either or, it really is an ecosystem. And one thing that people that only talk about big government don't understand, that healthcare is an ecosystem. The government, federal and state, doctors, pharmacists, patients, caregivers, all have a role to play. Drug makers, device makers, hospitals, all have a role to play in making things better. And if we try to single out bad guys to score cheap political points, which bringing us back to our earlier conversation about Senator Warren, I think is exactly what's going on. If we work together, we can solve the problem. If we're looking for bad guys, we're not going to solve the problem. There's a very well-known Japanese proverb that says, don't fix the blame, fix the problem. I think that's the way to go forward. Unfortunately, it's a very non-beltway proposition, but I think we can get there.
So Peter, one quick question. We've only got about a minute left, but we're starting to see these private companies like Liberty Health Share Services, but these health cost sharing services and companies, you know, sprout up everywhere. How do you feel about those?
I'm very excited about it. In fact, I had a piece in the Washington Times last week about health sharing. I think there are lots of alternative ways to give people coverage for healthcare. Some of it's more traditional than others. Health sharing is terrific. It's a faith-based proposition. A lot of people believe in it. Over 1 million Americans are doing it. And the government has recognized that it's a valid alternative to your more traditional paid healthcare insurance. I think we need to look at everything that's on the table. There's no one-size-fits-all proposition. We have to embrace every solution and see who it's right for, and then support ways for people to access them.
Yeah, I'm a big fan of privatizing nearly everything, actually. Take it away from the government. But Peter Pitts, thank you so much for joining us. He is the founder for the Center for Medicine in the Public Interest. He is also former FDA Associate Commissioner. Peter, thanks so much for joining us today.
My pleasure. Thank you very much.